Doctor, my son is only 2 or 3 months old, and we've noticed something very strange. The pediatrician told me that he has weakness in his larynx. What does weakness in the larynx mean? And what problem does he have? What happens is that many children, especially those who are born a little early, before the full 9 months, actually have a laryngeal cartilage that is a bit weak. And the larynx is supposed to resist closing when air is coming in as we breathe. So what happens is that the baby, right after birth, 3 or 4 weeks after birth, and up to 6 months, starts making a sound when breathing in. What kind of sound does he make? He makes a sound. This sound means that the larynx can't let the air in properly because the cartilage of the larynx, instead of being firm and allowing the airway to stay open, it actually closes. When it closes like that, the baby can't breathe well and also makes this sound. That's the only problem. No, there are more problems as well. Another problem is that with all the effort the baby makes just to breathe, their nutrition becomes very poor. That means they don't gain weight. They can't breastfeed properly. They experience acid reflux from the stomach. Also, the larynx and other problems can occur in the chest or even the heart as a result of the person or child not being able to breathe properly. So is this something to be afraid of? No, it's not that scary. 90% of these cases pass without causing any issues. The whole point is that we explain things to the patient, and that's important. There is very important information that every parent of a child with a weak larynx, or what we call Laryngomalacia, must know. The first thing is that if the child catches a cold, it should be treated immediately because the airway and larynx cannot handle inflammation or swelling, which could further narrow the airway, making it impossible for the child to breathe at all. So any cold should be treated very quickly. The second thing is, if this sound appears or gets worse, or if the child's color starts to change and turn blue, and the breathing muscles start to become visible, then you should go to the doctor immediately. That means you should go straight to the emergency room immediately if something like this happens. And during this time, we don't like the child to sleep on their back, because the more the child sleeps on their back and the more they cry, the more this breathing problem increases, and they can't catch their breath and may even stop breathing. So we always prefer to have the child sleep on their stomach, to lie on their stomach, and if any of these problems occur, go straight to the hospital. At the hospital, what do? Nothing much. They give the child some oxygen, treat any infections, and monitor them if needed. If the breathing is very labored and there's a serious problem and the child can't breathe at all, they arrange a tube so the child can breathe through it. So, does this issue get better? Yes, for many people, by around 1.5 years old, these symptoms disappear completely. For all those we give these instructions to, we also give them vitamin D and calcium, and we make sure they understand these instructions and follow them properly so that, God forbid, no problems occur. 90% of them don't need any intervention at all. Now, as for the one who called me yesterday, she told me they decided on surgery for her child. When do we need to perform surgery on a child who has weakness in the larynx and can't breathe properly? Of course, if the attacks they experience cause complete cessation of breathing or blueness, or if the larynx is so narrow that air can't get through, then in severe cases we perform surgery on the larynx. The second case is if the child can't swallow properly or can't feed well, which leads to significant weight loss. The third case is if we do heart tests, like an echo, and we find a problem in the right side of the heart as a result of low oxygen levels. In those situations, we intervene surgically to repair the larynx. The idea behind the surgery is that it's a simple procedure performed inside the larynx itself through the tube. We don't need to open the neck or anything like that. All we do is go to the area at the beginning of the larynx, which is narrow, and widen it. The best way is to use a laser because with the laser there is less swelling afterwards. The reduced swelling allows the child to respond immediately. We open up the laryngeal opening a bit, and sometimes we fix the epiglottis a little further away from the larynx, a bit forward on the tongue so the child can breathe, even if further surgeries are needed. There's no need to worry. 90% of people or children who experience this don't need surgical intervention. And this is the most common cause of suffocation or the sound I demonstrated for you, which appears in children. Don't worry, just always make sure you know the instructions and what to do. Wishing you all the best and a speedy recovery. If you enjoy these videos, please like them and subscribe.